Welcome to the Douglas County Cancer Services 2026 podcast. My name is Sharon Carlson. I am the chair of the board for Douglas County Cancer Services, and I've been a volunteer with the organization for 13 years. And I myself am a breast cancer survivor. Today with us, we have Dr. Connie Grady and Nancie Bogardus with us, who are also involved with the organization. So Dr. Grady, why don't you tell us about yourself and your career and your involvement with Douglas County Cancer Services?
I was born and raised in Roseburg, Oregon, and I worked here as a registered nurse for several years. Then I decided to go back to postgraduate school at Oregon Health Sciences University, where I graduated with my medical degree. And I returned to Roseburg and worked in internal medicine for 20 years. After I retired, I found myself on the other side of the bed rails. I was diagnosed with bilateral breast cancer after a screening mammography. I underwent chemotherapy, surgery, and radiation therapy. Douglas County Cancer Services helped me on this tumultuous journey. And in turn, I have started volunteering at Douglas County Cancer Services to help others on their cancer journey.
Well, thank you. And again, you're in a testament to getting those mammograms every year.
Yes.
Nancie, could you tell us about your involvement?
Hello, I'm Nancie Bogardus, and I'm a registered nurse. I've lived in Douglas County for about 4 years and have many ties to the Roseburg area. I've worked in healthcare and nursing since I graduated with a community health degree from Oregon State University in 1974. So you can see I've been at it for quite some time. I have a broad range of experience in nursing. I've been a nurse navigator, I've been a clinical research nurse, I've done school nursing, I've done public health nursing, and I've worked as a quality specialist for large healthcare systems and hospitals in several different areas of the United States. I've retired from being an employed registered nurse, and I only working as a volunteer now for Douglas County Cancer Services. I decided when I first moved here that I wanted to volunteer with Douglas County Cancer Services because I'd heard really good things about the organization, and I'd heard just nothing but positive remarks about what they were doing for the community. And I wanted to volunteer for an organization where I felt like I was giving back in an area that I would benefit people with my experience. My family's been touched by cancer through 4 different generations, my grandparents, my father, and I had a daughter-in-law who also struggled with cancer diagnosis. I know personally from caring for cancer patients and as a cancer patient myself and having gone through radiation, what families and patients struggle with and the challenges that they all have when they get a cancer diagnosis. And that's kind of how I got involved with Douglas County Cancer Services.
Well, thank you. And I just can't say enough how lucky and appreciative Douglas County Cancer Services is to have both of you and your clinical knowledge as part of the organization. You know, some important dates that are connected to Douglas County Cancer Services. This goes back to 1980, the early 80s, 1989 and 2025. In 1980, Roseburg opens its first cancer center on Umpqua Street. That's over off of Harvard years ago, and that's where I myself, back in that time, had my radiation treatments and my treatments at the old facility. But prior to that, patients were required to travel for their treatments. So how lucky we are here in Roseburg to have our own cancer center. So Nancie, can you tell us what occurred in 1989 for the city of Roseburg and Douglas County residents?
I do know that Douglas County Cancer Services was established in 1989 as a volunteer-driven nonprofit organization providing support and services to Douglas County residents undergoing cancer treatment. From my understanding, it actually started with volunteers. I think it was like 1 or 2 women that were helping cancer patients, breast cancer patients mostly, out of the trunk of their car with wigs and prosthetics and bras. And so it eventually expanded to what we are today, providing free, comprehensive support to Douglas County residents undergoing cancer treatment. A couple important facts to know about Douglas County Cancer Services, that's a mouthful, we call it DCCS for short, we are not a county agency. We are named Douglas County Cancer Services because we assist Douglas County residents only. We receive funds through donations and our fundraising activities, not through any county, state, or federal agencies. We also do not require those we help to receive their treatment or therapies locally. In other words, as long as you're a Douglas County resident, we can even help you if you are receiving your treatments in Portland, anywhere in the state, or even out of state.
Well, thank you. And knowing all those services that Douglas County Cancer Services provides, it's just overwhelming when you get that cancer diagnosis. And there is an organization such as DCCS, as you say for short, that is there to help in any way that they can. Mm-hmm. So Connie, tell us about what happened in 2025.
Well, on March 1st, 2025, we received a grant from Common Spirit Hospitals, which is connected with CHI, and they entrusted us with funds to expand our services to youth in Douglas County with cancer. We've also collaborated with Knight Cancer Institute to be able to identify that there are 70 youth patients in Douglas County with a diagnosis of cancer. So we wanted to extend our services to these people.
And it is an interesting knowing that those children and those families, when those children get diagnosed, where can they go for the treatments? They need to travel to either to Portland, Medford, or sometimes even out of state to San Francisco. Mm-hmm. So, having those funds to at least help support those families when they do have to travel is very, very important. So Nancie, can you tell us about the status of the health services for the youth?
With our Common Spirit grant, we've established a partnership for the Douglas County youth who have been touched by cancer, either in current treatment or post-treatment. Many of you know and have heard of Camp Millennium, or better known, I guess, as Camp M. It's a wonderful summer camp experience for Oregon and Southwest Washington youth 5 to 16 years of age. Those dealing with cancer, diagnosis themselves, or a sibling possibly with cancer, or even a parent or guardian that has had cancer. Douglas County Cancer Services has scholarships available to Camp M for Douglas County youth who are in cancer treatment or have been treated for cancer. Douglas County Cancer Services, or DCCS as we call it, also works with Cougar Ridge Ranch to provide scholarships for equine therapy. Youth who are learning to cope with the challenges of cancer or their cancer treatments can work with trained staff and supervisors who provide hands-on safe interactions with horses, ponies, and many other farm animals. We do provide scholarships for this great opportunity also. Douglas County Cancer Services can help Douglas County residents that are in cancer treatment by assisting with gas cards for transportation, food cards. We offer financial assistance with a variety of living expenses as well. And we provide wigs, bras, prosthetics, and that type of item that breast cancer survivors might need. However, we do not help pay for medical or health-related services such as co-pays and prescriptions. We can help residents of any age. All services are provided at no charge to cancer patients, and it is dependent on our funding and what's available at the time that they apply.
Connie, is there anything else you'd like to add about services for adult cancer patients?
Well, in Douglas County, where the children or the youth need to travel out of the area for treatment, adults have many options available. CHI is able to locally provide surgical services, laboratory services, and pathology. The Community Cancer Center, which is next to CHI, provides radiation, oncology, and is in partnership with Oregon Health Sciences University. So our doctors here are able to talk with OHSU freely and receive instruction or collaboration with treatment. Also, the Community Cancer Center houses private oncology clinics. So adults have many services available to them which are not available to youth with cancer in Douglas County.
Yeah, that is something to really think about when you think about having a child diagnosed with cancer.
Mm-hmm.
Connie, can you tell us a little bit more about educating the pediatric providers as part of, this CHI grant and for the children?
Right. Well, the Common Spirit Grant has allowed us to meet with several pediatricians and providers of youth with cancer. We provide information to these providers about Douglas County Cancer Services and how we are extending to the youth in our community. We are here to support both the patients and their families. And as Nancie said, we are able to have gas cards, grocery cards, and we help with rent and utilities also. We have been collaborating with services in Portland, such as Dornbecker's Children's Hospital and Randall's Children's Hospital, to make the care that is received out of town easier and more affordable. We also are collaborating with Asante Pediatric Oncology Clinic in Medford, Oregon, to make that trip more affordable.
And I'd just like to add in there, I think it's really important for our viewers to understand at this time in the state of Oregon, only children birth to 18 years of age can only receive their cancer treatment in the Portland area at the Dornbecker Hospital that's associated to OHSU. So all children are basically traveling to the Portland area, except there is the option in Medford through Asante for outpatient infusions. So all pediatric cancer patients in the state of Oregon are basically traveling for their treatment. Now, if they can't be treated in the Portland area at Dornbecker through OHSU, there's the option of going to San Francisco, Seattle, Houston, and some other larger metropolitan areas like where the MD Anderson Cancer Institute is. They do treat children, but for the children of Oregon, they're traveling to Portland or to Medford for their treatment, no matter where they live. And I think that's important for everybody to understand why it's so important to help these families with children, with gas cards for transportation, food cards for, the expense of being away from home.
Exactly. And you think children, their parents, when they're dealing with this and have to travel to these appointments, that they have to leave work and be off work, and that could be lost wages for them during this time, which can be devastating to their finances and to the household. Bless our hearts that we have this here to help these people. So speaking of that, Nancie, can you tell us a little bit about, you talked, and it was mentioned a little bit ago about fundraisers, but how does Douglas County Cancer Services get their funds? And explain a little bit what those fundraisers are and what they consist of.
Douglas County Cancer Service is, like I said, a volunteer-driven organization that raises funds through fundraising events and through direct donations from individuals and organizations. We have an annual spring golf tournament, and I believe that's coming up again in May. It'll be out at Bar
That's
Run.
right.
And we have had, we just had our 25th Breast Cancer Tea and Fashion Show, and we do that every October. And that's a big fundraiser, and there's an auction items and a fashion show. We've started a new event or activity to raise money, and that's called Wine for a Cause dinners, and we do that in the summertime. We'll have our second one this year. All of the funds we raise or receive remain locally to assist Douglas County cancer patients. Douglas County Cancer Services is funded through the generosity of individuals and organizations that donate to us, and by the hard work of the volunteers and the board with all of our fundraising efforts. And that's basically where our funds come from. Fundraisers and direct donations from individuals or large organizations have given us money also.
You know, and we're very lucky living in an area where everyone in the community is so generous.
They are very generous, you know.
So, Connie, would you like to talk a little bit more about that, what your experience has been
Well,
with the generosity of the community?
yes, our community is very generous, and we also have foundations, the Josh Bidwell Foundation, the Ford Family Foundation. We also receive grants, and this was my first experience with working with a grant. And we do want to thank Common Spirit Hospitals for this opportunity and for their ability to assist us with extending our care to pediatric patients in the community.
Well, we are very thankful for that, especially as you both have mentioned, those that donate to us individually or the fundraisers that people come and support, and like you mentioned, Connie, the grants. So at this time, though, one of the things we'd like to wrap up with is if you could just, Connie, tell us a little bit about, an overall wrap up of how many children are we talking about when we talk about the children's program, that are in Douglas County.
Right. So this has been a very interesting journey for me to be able to look at the numbers and to try to make good judgments about what we should be doing in Douglas County for these cancer patients. And there are approximately, at any time, 70 youth living in Douglas County who have been diagnosed with cancer. Now, not all of those are in treatment, but they do carry the diagnosis of cancer. And the rate of cancer in Douglas County for youth is approximately 5 to 10 new cases of cancer every year, which adds to this number. As we said, there are no local facilities to care for these patients, and so they do need to travel out of Douglas County. But even though they're receiving their treatment outside the county, the Douglas County Cancer Services is willing to help them with their needs.
Well, thank you both for being here today and sharing that information, and hopefully Douglas County residents, and hopefully not many more, will receive that diagnosis for their children. But if they do, that they know that Douglas County Cancer Services is here to support them. And how can you contact Douglas County Cancer Services? We're located in the Cancer Center at 2880 Northwest Stewart Parkway on the second floor. You could call us at 541-440-9409 or access our website at DCCS, all one word, .org. Thank you.
Thank you.